Hello everyone. In this class, we'll learn about fetal and neonatal circulation. The objectives of this class would be to appreciate the design of fetal circulation, list the special features of fetal circulation, list the changes in fetal circulation that occur at birth, correlate the circulatory changes that occur in fetuses due to the developmental abnormalities. The main difference of circulation in fetus, that is before birth, is that fetal lungs are functionally inactive and fetus derives oxygen and nutrients from placenta. The blood that is 80% saturated with oxygen from the umbilical veins enters the liver and some amount bypasses the liver and enters inferior vena cava through ductus venosus, which drains into the right atrium. About 50% of the blood from the right atrium enters the left atrium through foramen ovale. Another 50% of the blood from right atrium enters into the right ventricle, from where it is pumped into the pulmonary artery. As the pulmonary vascular resistance is very high because the fetal lungs are collapsed, only the small quantity of blood reaches the left atrium through pulmonary veins. The main bulk of the blood from the right ventricle directly enters the aorta through the ductus arteriosus, which is then distributed to the whole body. However, the umbilical artery, which arises from the aorta, transports blood to the placenta, where it is oxygenated and sent back to the fetus via fetal veins. This placenta functions like lungs during fetal life. So this diagram showing how the fetal circulation is designed. The oxygenated blood goes to the fetal circulation through the umbilical vein. It reaches the liver, some amount bypasses, and then it is going to reach to the inferior vena cava, then to the right atrium. From right atrium, most of the blood goes to the right atrium to the from the right atrium to the left atrium through foramen ovale uh, and the ductus arteriosus. Okay, so then this blood is pumped to the aorta and it's going to supply oxygen to the different parts of the fetal blood. Then the umbilical artery is going to drain into the placenta, which carries mostly the deoxygenated blood from the fetus. Special features. Right ventricle pumps blood into pulmonary artery against higher resistance as the pulmonary vascular resistance is very high. Most of the right ventricular output enters directly into the aorta through ductus arteriosus. The right ventricle receives blood from placenta and pumps into aorta, from where about 60% of the blood goes to the placenta for oxygenation and only 40% is distributed to the different parts of body. This occurs because peripheral resistance of the fetal vessels is high, whereas the resistance of the placenta is relatively low. About 50% of the blood from right atrium directly enters into the left atrium via foramen ovale. Oxygen saturation of the fetal arterial blood is much lower than that of adult. However, fetal tissues are highly resistant to the effect of hypoxia. Fetal hemoglobin also has a higher affinity to the oxygen. In fetus, cardiovascular regulatory mechanisms operate mainly by the local factors. The baroreceptors and chemoreceptor reflexes develop at about 30th week of intrauterine life. Changes occurring at the birth. Closure of the umbilical vessel ceases the blood flow, resulting closure of ductus venosus. The clamping of umbilical vessels immediately after the birth causes asphyxia that activates the respiratory center, resulting in expansion of the lungs. As the lung fills with air, the pulmonary vascular resistance decreases significantly. Closure of umbilical vessels increases the total peripheral resistance and blood pressure. Left atrial reserve is raised above the volume of blood present in inferior cava and right atrium. This occurs due to the decreased pulmonary resistance, increases the blood flow to the left atrium, and decreased flow of blood to the right atrium due to the closure of umbilical vein. Occlusion of umbilical artery increases the resistance to left ventricular output. The change in the pressure gradient across atria abruptly closes the valve of foramen ovale and gradually the interarterial septum closes. The pulmonary arterial pressure decreases significantly due to the decreased pulmonary vascular resistance. This, along with the increased aortic pressure, reverses the flow of blood through the ductus arteriosus. However, constriction of the ductus arteriosus begins within few minutes and is completely closed with 1 to 2 days after birth. Before birth, thickness of the both ventricles is equal. After birth, thickness of the right ventricular wall decreases, whereas the left ventricular thickness is going to increase. Some of the clinical importance: atrial septal defect, non-closure of foramen ovale after the results uh, in mixing of oxygenated blood with the deoxygenated blood, thereby decreasing the oxygen supply to the tissues. Patent ductus arteriosus, failure of closure of ductus arteriosus results in the blood flow from aorta to pulmonary artery as aortic pressure is more. Oxygenation of the tissues of the body decreases in this condition. Tetralogy of Fallot, a condition occurring rarely in which there are four cardiovascular defects: ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, and overriding of aorta. Due to the ventricular septal defect and pulmonary stenosis, oxygenation of blood is grossly reduced. Therefore, tissues suffer from severe hypoxia and cyanosis is going to develop. This is in brief about the fetal circulation. Thank you.